All adults and children over the age of 12 in the United States are now eligible for the COVID vaccine. But according to the Washington Post, the U.S. is now averaging fewer than 1 million shots per day. Their analysis also found that the slowdown is significant in both the South and Midwest. This comes less than a month before July 4th. President Biden set a goal of getting at least 70% of adults with at least their first dose by the holiday. But now health experts are concerned that number may not be reached. For more on this, let's bring in Brianna Abbott. She's a science and health reporter for the Wall Street Journal. Brianna, welcome. Thanks very much for being with us. So what's contributing to this vaccination plateau?
So there are a lot of different factors. And one of the main reasons that we're seeing vaccines plateau is that the people who were really eager to get vaccinated or most able to get vaccinated have already been able to get vaccinated for the most part now that we sort of have an ample supply of vaccine in the US. And so the people who haven't yet been vaccinated definitely either have more reservations or they have less access. So it's just harder to get those vaccines, or they're less likely to do it. So we've really picked sort of all of the low-hanging fruit, so to speak, and it's going to be a bit more challenging sort of reaching those who haven't yet been vaccinated.
Well, a new Gallup poll says 78% of unvaccinated Americans are unlikely to change their mind. Those numbers are not expected to change. Why?
A few different things. So the thing about those numbers, too, is that vaccine hesitancy, even if people say that they're not willing to change their mind, there is a sect that is pretty much unmovable, but there are people in the middle that you can sort of not persuade, but they'll come around sort of eventually. And the number of vaccine hesitant has sort of been slowly shrinking throughout the vaccine rollout. But there are a couple of reasons. People are worried about side effects. They're worried about potential long-term side effects. And even though we know that the side effects of the vaccine are significantly less than the risk from the virus itself, you still have concerns from that. You have people that just don't necessarily trust the government. You have people who don't see COVID as that much of a threat, who just don't really see the need to get vaccinated. And people just have different reasons. And so the real challenge is going to be targeting people with those individual reasons to try and get through to them to sort of get them vaccinated.
Well, switching gears, the British government's latest COVID data shows the country is experiencing another surge in infections. How is this possible in a country with one of the most robust vaccination rollouts? And is this something Americans should be concerned about?
Well, it's definitely still possible, just because even though the UK and the US have had very robust vaccine rollouts, there's still a significant proportion of both of those populations that's unvaccinated. And sort of that still gives the virus an opportunity to spread. There's also reports of the Delta variant, which is the variant that emerged in India, that's still, circulating in the UK now, and there's sort of data that suggests that it's more transmissible, potentially more than the B117 variants. So there's still opportunity if there are pockets of unvaccinated people. And when it comes to the US has always trailed the UK in terms of cases just throughout the pandemic. But of course, now with the vaccines, that's going to be just much more of a wild card. And it's really difficult to say sort of what's going to happen in the US. But it just goes to show that even though things are looking a lot better, the pandemic is still not over, especially for those who are still unvaccinated.
Yeah, certainly a reminder of that. Well, the Biden administration plans to send 80 million COVID vaccines abroad by the end of June. 75% of those vaccines will go to a multi-billion-dollar program called COVAX. Where will these vaccines be going, and how will COVAX help distribute them?
So these vaccines will be going essentially to where there's the greatest need, but they're also going to a variety of countries. So you'll sort of see them spread out sort of through the COVAX program. 75% are going directly through COVAX, and 25% are going directly through the US, where they are deciding to distribute them. And COVAX the 80 million is definitely a good step, and experts are excited to see that the US is starting to send some of our vaccines sort of to countries where there just really aren't that many. But they also say that that's still the 80 million, while it's a substantial number, it's still sort of a drop in the bucket compared to what's needed for, all of those countries that still have not vaccinated very many people and are still seeing pretty severe outbreaks. So it's a step in the right direction, but definitely sort of need more of an effort, not only from the US, but, from countries in Europe and anywhere sort of where we're really seeing most of the people getting vaccinated in their countries.
Right. It really is a global pandemic. Brianna Abbott for us. Brianna, thank you.
Yeah, thank you for having me.